Smoking and alcohol are two habits that many people turn to for stress relief, social bonding, or routine comfort. But both have deep and lasting effects on the heart that often go unnoticed until real damage has already taken place. When a person smokes, the chemicals in cigarette smoke enter the lungs and travel directly into the bloodstream. These chemicals are not harmless. They irritate and damage the inner lining of blood vessels, making the arteries stiff and narrow. When arteries become narrower, the heart has to pump harder to push blood through them, which raises blood pressure and adds constant stress to the heart muscle. Nicotine also causes the blood vessels to tighten immediately after smoking, even from a single cigarette, reducing oxygen supply to the heart. At the same time, carbon monoxide from cigarette smoke reduces the amount of oxygen the blood can carry, meaning the heart must beat faster and harder just to supply the body with what it needs. Over time, this repeated stress weakens the heart and causes fatty cholesterol deposits to stick to the vessel walls more easily, forming plaque. As plaque builds up, blood flow becomes more restricted, increasing the risk of heart attack, stroke, and heart failure. Many people believe they are safe because they smoke only socially, or just a few cigarettes a day. But even low-level smoking causes blood vessel damage. The body does not differentiate between heavy smoking and occasional smoking. Every puff delivers harmful chemicals that create long-term injury. The heart remembers every cigarette. Alcohol affects the heart differently, but just as powerfully. When a person drinks alcohol, the liver processes it. But if alcohol intake is frequent or heavy, the liver becomes overwhelmed and fat begins to accumulate in the liver cells. Fat buildup in the liver affects cholesterol processing in the body, often raising LDL, the bad cholesterol, and lowering HDL, the good cholesterol. This imbalance encourages plaque formation in arteries, increasing the risk of blockages. Alcohol also raises blood pressure because it stimulates stress hormones and causes blood vessels to tighten. Over time, this leads to a condition called alcoholic cardiomyopathy, where the heart muscle weakens and becomes enlarged. An enlarged heart cannot pump blood efficiently, leading to fatigue, swelling in the legs, shortness of breath, and eventually heart failure. Even those who drink occasionally may feel temporary effects like palpitations or irregular heartbeat, especially after binge drinking. Alcohol can also disrupt the electrical system of the heart, leading to rhythm problems like atrial fibrillation, which can increase the risk of stroke. And while some may have heard that one drink a day is good for the heart, this is an oversimplification. What matters most is the person's overall health, liver function, metabolism, stress levels, and genetics. For many people, even small amounts of alcohol contribute more harm than benefit. When smoking and alcohol are combined, the damage happens faster and more intensely. Smoking reduces oxygen supply, while alcohol weakens the heart muscle, and together they accelerate plaque buildup, increase blood pressure, and strain the heart's ability to pump effectively. This combination significantly raises the risk of heart attack at a younger age. For many people, smoking and alcohol are linked to emotional triggers, stress, loneliness, habit, environment, or social situations. Understanding this helps in making change possible. Instead of trying to quit suddenly or with force, gradually reducing frequency while replacing the habit with healthier coping mechanisms can be more successful. Deep breathing exercises, regular morning or evening walks, talking to supportive friends or family, engaging in meaningful hobbies, or practicing simple mindfulness activities can reduce the emotional dependence on smoking or drinking. Staying hydrated also reduces cravings because dehydration often intensifies stress signals in the body. If someone has been smoking or drinking for years, it is never too late to benefit from stopping. The body begins to repair itself almost immediately. Within 20 minutes of quitting smoking, blood pressure starts to return toward normal. Within a few weeks, circulation improves and breathing becomes easier. Over months and years, the risk of heart disease gradually decreases. Reducing or quitting alcohol allows the heart to beat more efficiently, blood pressure to lower, and cholesterol balance to improve. The liver is also remarkably capable of healing when given rest. The goal is not perfection, but steady progress. A person does not need to quit overnight. Even small steps matter. Replacing one cigarette break with a short walk, reducing weekly drinking by just 2 or 3 days, or switching to non-alcoholic beverages in social settings can make a real difference. Keeping the body well-nourished with heart-friendly foods like fruits, vegetables, nuts, seeds, whole grains, lean protein, and omega-3 rich oils helps repair inflammation inside arteries. Drinking plenty of water, getting consistent sleep, and engaging in moderate daily physical activity gives the heart the conditions it needs to recover and strengthen. If cravings are strong, it does not mean failure. It simply means the body is adjusting, and adjustment is part of healing. Progress may feel slow, but every cigarette not smoked and every drink not taken is a win for the heart. In summary, smoking reduces oxygen, damages blood vessels, increases blood pressure, and accelerates plaque buildup. Alcohol changes cholesterol balance, weakens the heart muscle, triggers rhythm problems, and raises blood pressure. Together, they silently increase the risk of heart disease, stroke, and long-term heart failure. But change is always possible. The heart responds to care. Small improvements made consistently can protect heart function, improve energy, reduce stress, and increase lifespan and quality of life. Recovery begins with awareness, continues with intention, and becomes habit through patience and kindness toward oneself.